Welcome, everybody. We'll get started in just a couple minutes. Well, hello and welcome. I'm Jeff Jagger. I'm your host and guide for the monthly Cancer Prevention and Wellness series sponsored by the Cancer Survivors Park Alliance in the upstate of South Carolina. We're very excited about the lineup that we have this year of various topics of integrative medicine, lifestyle medicine, and how our patients and our survivors and our caretakers navigate the process of dealing with a cancer diagnosis and moving forward in a healthy manner. Before we get started with tonight's session, just some housekeeping items. We are going to have everybody muted just to prevent the background noise. You are welcome to ask any questions via the chat capability of Zoom, and we'll be monitoring those and asking our speaker those questions as we see fit. This will be a recorded session. And that recorded session is available for review and to tell your friends about, and that will be on the Cancer Survivors Park website, which is www.cancersurvivorspark, all one word, .com. We have most of the people who are getting this content off of the website. And we're going to try to do a better job of getting people links via social media so that they can review these things after the fact. But we like to have a live audience so that we can answer questions in real time. Tonight, we're really, really excited. We're going to go for the first time international, actually intercontinental. We have Sally Ann Creel, who's coming to us from the Queensland state of Australia. She is a colon cancer survivor. She describes herself as a nurse, so she's a clinical nurse consultant. She's a wife, she's a daughter, she's a sister, and she's a mom of 2 sons. And when she developed cancer, she gave herself the title of cancer mom, but she's been very much an advocate. She's written a book, which is a book I've read now a couple times, and does a really, really wonderful job of talking to the cancer patients about all the things that they have to think about, including the people that they're taking care of. Yes? So we are talking to her from the Sun Coast of Australia, where it is 8:30 tomorrow morning. It is summer there because they're in the southern hemisphere, and so it's, she gave me in centigrades, but I'm trying to convert that to Fahrenheit, but probably 70 now, going up into the mid 80s. So a different climate now, and we want to talk to her about her process of dealing with her diagnosis and all of the things that she had to navigate. You may be wondering how we found Sally. Actually, Sally and one of her friends, Joe Serace, who's also a colon cancer survivor from Australia, were looking at the possibility and still working diligently on the possibility of doing a cancer survivors park or garden in Australia, and they were searching the web and came upon us, and so we have developed a kind of a relationship. So hopefully we can start franchising these around the world. But that's how we got to know Joe and Sally, and hopefully as they get closer to finishing their park, they'll want us to come over and do a site visit. So we're looking forward to that. So Sally, welcome. I want to have you kind of go over your story. You kind of put it into BC, before cancer, and AC, after cancer, and so just a little introduction, and we got some slides here that you can go through as well, and then we'll kind of have more of a discussion back and forth. But welcome.
Thank you, and what a fantastic introduction. And I'd just like to start by, I guess, acknowledging all of the fantastic work that you and your team does. Wellness through cancer is certainly incredibly important to me. It's a philosophy that I have embraced and thought about really since the day of my diagnosis. So congratulations on all of the really great work that you're doing. And as you mentioned, we really hope to see something equally or will aspire to have something equally as fantastic as what you do have there. So I guess in terms of my story, up on the screen you can see my two little boys. Ollie, he's 3 at the time. Theodore, there is 18 months. And this picture was taken probably 3 months after my diagnosis. So I grew up in Queensland, which is, of course, one of our states on the southeast side of Australia. And I'm 42 at the moment. And I became a registered nurse when I was 21, and really when I began nursing, healthcare, patient advocacy, putting the patient at the centre of their care is something that's always been incredibly important to me. So I guess although I began my career in intensive care medicine, I have moved, of course, into the cancer wellbeing space since my diagnosis. I was diagnosed, as you've mentioned, with colon cancer. Here in Australia, we refer to colon cancer as bowel cancer, and that covers anywhere from the colon, rectum, and anus. And I was diagnosed at the age of 38. So I call myself, I guess, one of the lucky ones. And although there's nothing actually lucky about having cancer, I was lucky in that I had an incredible GP who picked up on my very early symptoms, which were abdominal pain and cramping, and just not feeling myself. And I did have a history of some benign polyps, which were 5 years earlier. And I went in to see my GP and I said, look, I don't feel quite right. I've had some ongoing abdominal pain and cramping. It's lasted for about a month. I didn't have any bleeding. I didn't have any rapid weight loss. And of course, those symptoms, as we know, are associated with the later bowel cancers. Bowel cancer itself is incredibly difficult in some cases to diagnose, particularly in the early stages. And my fantastic GP, who wasn't my regular GP, she said to me, Sally, look, I think let's rule out everything that we need to, and let's cover all bases. So she sent me off for some blood tests, which were completely normal, an ultrasound, which I didn't actually end up having because I had the colonoscopy. And I have to admit that when she gave me the colonoscopy referral, I thought, oh, this is a bit serious. I expected her to say, well, let's just watch and wait. Let's consider some other things. Because, of course, with bowel cancer, the symptoms are very similar to things such as, food intolerances or irritable bowel syndrome, women's problems. So it's, again, quite difficult to identify early. So I held on to that referral for about 6 weeks thinking, well, I'm too busy. I don't have time to do this colonoscopy. I'd recently returned to work. I was just getting back into my career, and I went in to have that scope 6 weeks later, which is a very good turnaround time. That was done privately. And at the end of the scope, I was told by the gastroenterologist that he was concerned about one of the polyps that he had found. That was on a Friday. And then on the Monday morning, I was phoned by my GP to come back into the practice to be told that I had cancer. This is me having some surveillance scanning, still feeling pretty average. That was 12 months after my bowel cancer diagnosis and bowel resection. Yeah, so that's, I guess, my early journey.
You've already had the colon resected and you're getting a CT scan here?
Yes.
Okay.
Yeah, so Jeff, I had the right side of my bowel removed, which is called a right hemicolectomy. They took out about 30 centimeters of bowel. I was fortunate in that a lot of that surgery was keyhole, a small open component there, but still a very major surgery, of course. And probably, although my surgeon did say to me, it's a big operation, the hard work will really start when you get home. I wasn't quite prepared, I have to say, for how I felt post-operatively. I woke up on a general ward. I had a lot of drains, of course, a catheter, a lot of monitoring. And I remember waking up and having, incredible pain, particularly from the anesthetic gas that they use under my ribs. And the day after surgery, just feeling incredibly weak and trying to mobilize and walk. And I thought, oh my goodness, what is this? It really wasn't something that I was prepared for as a 38-year-old. Feeling so unwell. I really felt like I'd been run over by a truck. It was tough. Yeah.
We advance the slide.
So this is my book, and I'm incredibly proud of this book. It's called A Woman's Guide to Navigating the Invisible Cancer Load. And I guess the idea for me initially came from my writing that I began around about 6 months into my cancer recovery. The first, I guess, prompt was when I was phoning around a number of respite organisations. Here in Australia, we do have very good healthcare. A lot of it is free. And we do have respite support for carers. And I was on the phone, phoning multiple different organisations trying to get my husband some respite, because what would happen was that I would organise for him to, for example, take the afternoon off, leave the house, don't come home early from work, for example, go and spend some time for himself. But every time I seemed to do that, I would become unwell. So unwell with dizziness, diarrhea, needing to be in bed, for example. And I thought I could see the strain, of course, through him. 6 months on is a long time to be a carer and a worker and a parent of 2 young children. And I was phoning around the organisations, and no one could help me. And the reason why they couldn't help me was because of my age. The respite support services were only available for patients over 65. They were also only available for people that had a chronic condition, and cancer is not always acknowledged as a chronic condition, depending, of course, on the individual person. So at the end of that period, I thought to myself, I really need to, as soon as I'm well, put together some cheat sheets, some helpful information on anything that is going to help a cancer patient's journey easier, because the amount of time that I'm spending, and it's spending phoning around and it's making me feel physically more unwell is not helpful to me or my recovery. So I began a blog that is called the Awakened Mama, and I started to write on all of the topics that patients were talking to me about, the topics that were important that I would see in forums, certainly the questions that I had as a patient, but also as a health professional. So I guess it's been quite a unique experience as a health professional walking in the shoes of a patient. So being able to see healthcare from a completely different side has been incredible. So I started to put the blogs together, and I also covered really important topics, for example, nutrition, body image issues, financial distress, caring for the carer, and the gifts and lessons of cancer, and a number of other topics, including exercise. So I covered, I guess, patient story, my story, but then I linked in with experts to talk to patients about what is really important. And I call these topics, I guess, the topics that we don't hear a lot about as cancer patients, because of course, but for us and for our medical team, it often is about, well, let's focus on the acute care, and the acute care is the life-saving care. And of course, it's very important, but there are all of these other invisible impacts that we don't often hear about and we don't often see. Some patients aren't speaking about them because they think, well, this is just my lot in life. I can't complain on the live, for example. It's just a side effect that I have to accept. But of course, I know as a health professional that there are some really great experts, there's great support, there's great services, there's great information. So this book is my way of giving really valuable, low cost information to patients to make their journey a little bit easier. But also a lot of health professionals do read my book. And in the cancer space, that's nurses, that's allied health, that's medical professionals, to get really an inside view from the patient's perspective and from the clinician who became the patient.
When Sally mentioned that she had written this book, I did order it, and of course off Amazon, and read it. And obviously, as a retired oncologist, I spent a lot of time trying to think about how to cure the cancer or how to make the journey easier from the disease standpoint. But I wish that I had had something like this so that I was more knowledgeable of what was going on with my patients and their families behind the scenes. It's a very well-organized book. There's lots of anonymous quotes, vignettes from other cancer patients when she's talking about a specific problem. And she brings in some expertise from numerous other specialties, including exercise physiology, including mindfulness, meditation, nutrition, and whatnot. So it's 212 pages. At the end, there are a bunch of references. A lot of them are references that are more Australia specific, but I think it is a book that a lot of new cancer patients would be very well served to be recommended.
Thank you so very much, Jeff. There's, as you've mentioned at the back of the book, the resources I feel are really relevant to men and women and also carers, and across the patient journey. And I really do hope that your listeners do find some of those resources helpful. Podcasts in particular, I have found incredibly helpful. They're things that patients can put on in the background when they're not feeling well as well. And it's easy for them as well to forward on to their friends and family and say, have a listen to this. This is what I'm going through. So I've got some really good links to podcasts there. And of course, I do have a website as well. So we can share that information as well. I do have a lot of up-to-date resources there.
Right.
I do caution, of course, with Dr. Google. In the early days, when I was diagnosed, I did a lot of searching, and that mainly was around, I did look at the statistics. So in Australia, 1 in 15 people incredibly are diagnosed with bowel cancer. So by the time they reach the age of 85, 1 in 15 people will be diagnosed with bowel cancer. Of those patients, 15, over 15,000 Australians are diagnosed with bowel cancer every year. It is our second deadliest cancer behind lung, and it's our most deadliest cancer for adults aged 25 to 44. So a disease that, although we don't hear a lot about in the media, for example, it's not as commonly discussed as our other gender-based cancers, which is something that I advocate and raise awareness about. It is obviously very prevalent. So having access to quality information is very important. And I do talk to patients about staying away from Dr. Google, going to really good sources, because when I would search for stories, of course, I heard about all of the bad stories. The media often will publish stories that are emotive and that are difficult. So I would come across young mum dies of bowel cancer. And that, of course, was incredibly unhelpful for me. And in the same light, I do talk about online forums in the same way. So I really encourage patients to find a forum that they find helpful and inspiring and gives them really quality information. There will be times in your journey where you will hear about other patients who have passed away, which reminds you, I guess, of the vulnerability of life. And when you can sometimes liken your story to another patient's story or see yourself in that patient, it can be very confronting. So I guess for patients to give yourself permission to come off those sites and to perhaps just go in if you need to ask a particular question. And then when you're feeling stronger, then you can go back on if that's something that you do want to do. But I would bring myself off the forums, particularly in the first sort of 6 to 12 months whenever I needed to. And that's a really good self-care strategy. Likewise, for patients, reminding themselves when they do hear the hard stories, a really great mantra is, "That's not my story." So I really encourage patients and anyone really to bring that in. So you might hear about a patient of a similar age who passes away or has a poor result, for example, who might have children who are the same age as you, but just reminding yourself that everyone's story is different, and that doesn't mean that that's going to be your outcome. It's a really good strategy.
So let's move on so we can delve into the book. We do have one comment in the chat about the Colon Club in the United States. It's colonclub.com, and they've been instrumental in reducing the colonoscopy expenses for exams for patients that are somewhat younger.
Right, I can't see the comment actually. Is it?
That's fine. I'll just share that with you. But here's Sally with her long hair showing.
I hear nothing but wonderful things about the Colon Club. Actually, we've got here in Australia, we have Bowel Cancer Australia, which is an incredible national organisation. And I have worked with them to set up their national online survivorship network, which is incredible. And we have a number of members who do talk about the Colon Club, a lot of good quality information. So it's a really great resource. It's great to hear. So this is me on the front of our National Nurses Union magazine. And I've been really fortunate through the nursing community. I've been celebrated, I guess, for the work and the advocacy that I do in the bowel cancer space. And I wanted to highlight, I guess, what it is like for from the patient's perspective. And again, uniquely being a clinician stepping into the patient's shoes, you do see, I guess, a lot of opportunities and the way that you would like to improve things for our patients. And, there are a lot of messages that I took away going through the patient journey. And one of them has been around, I guess, lack of awareness around the young onset bowel cancer statistics. So even I had my most recent surveillance colonoscopy at the end of last year, and I was told at that time by the nurse who, prepared me for the procedure, well, I haven't seen anyone like you who is this young, who has had bowel cancer. In the early days, I would find that quite confronting, and it would make me, I guess, irritated that why do the healthcare professionals not know about people like me? Now I see it as a teaching opportunity, and, of course, use the opportunity to say, well, actually, the statistics are that 10% of Australians who are diagnosed with bowel cancer are actually under 50. And the reason why this is really important is because, younger adults need different types of survivorship care. They need consideration of their time in their life. A lot of them will have carer responsibilities. And of course, the longevity of impact from cancer is real. So when we're talking about things like neuropathy, for example, when we're talking about brain fog, when we're talking about financial strain, getting back into the workforce, the needs of younger adults are very different to the needs of older adults. And that's important. It's also important for our emergency departments, for our general practitioners to be aware that when a patient is presenting with overt bowel cancer symptoms, so bleeding in the stool, rapid weight loss, abdominal pain, cramping, those sorts of things, which we often hear about, it is not just an older person's disease. And that is important. I do encourage clinicians, when they're assessing their patients, to rule out bowel cancer rather than think of it as a very unlikely condition. And that will help us to make sure that we do have timely diagnosis of bowel cancer. So in Australia, under 50% of our bowel cancers are diagnosed early, and that is a problem.
That's great. Let's go through these next slides pretty quickly because I want to delve into the meat of the book.
Yeah. So this one, an article that I published recently, so the end of November last year, I was invited by a nursing professor at one of our universities here in Australia, the University of Canberra. And I was invited to provide an opinion piece on what it is to be a clinician who became a patient, and what are my recommendations. So I talked here about tailoring survivorship care, having equal access to specialty bowel cancer nurses, and having some standardized approach to how we manage survivorship care for our cancer patients. So that's about equity and access to quality care. So that was a really great article.
Great.
So this is us. This is our family at Christmas, just gone. So about, a month or so ago. I live on the Sunshine Coast, so that's us on the beach just down the end of our street. So we're very fortunate to where we live. My boys now are 7 and 5, and this is my husband Yuri. He's an academic. He's an exercise scientist. So it's really, I guess, cathartic to look back and see the journey that I have been on. And I think to give people some hope. I think as patients, when we receive our diagnosis, for most of us, we think, well, am I going to die? And that's a real fear. And it's completely valid. Media and society often paints a picture of the worst case scenarios. So the more we can share about, there are good stories through cancer as well. It's really important for people to be aware of and to draw some hope and inspiration and help them through their journey.
It's a beautiful family. So just to reiterate, you went to a new general practitioner, a new GP, with what would have to be characterized as non-specific symptoms, no family history, no occult blood. And I know you did get some imaging, not a CAT scan, but maybe an ultrasound, and we went directly to a colonoscopy, which was the only way your cancer was going to be found.
Correct.
So I hesitate to say anybody who's been through a right hemicolectomy is fortunate, but I'd have to say that given the circumstances of your presentation, to find this early and curable is indeed fortunate. You had this diagnosed in 2018, so you're entering into your 5th year. When you're diagnosed, you are immediately classified as a cancer survivor. And now 5 years into that course, how are you feeling from the standpoint of confidence in your health and anxiety, and are you still thinking about mortality, or how do you feel? And obviously, I don't know that you would have been an author and writing all these journal articles, without this diagnosis, but clearly it's impacted you in a way that you went out to advocate for other patients. So where's your mindset now?
Yeah, I think that's a really good question, Jeff. Time is certainly important. So as time goes on for me, the easier it becomes. I am, of course, very fortunate that with every CT scan, with every colonoscopy, with every blood test, my results are very positive. So they've all been clear. And as you've said, for bowel cancer, when we can pick it up early, over 90% of patients can be cured. So that's an incredible rate. In saying that, going into scans, for example, I still do have that trepidation. For me, that becomes less, as I said, over time. I have a lot of strategies that I bring in there. I do personally, I work on meditation each day. That's become I guess a part of my life now. I do a lot of positive visualizations. I do journaling. I work at looking after myself. So I do a lot of self-care. But still, of course, the body remembers, the mind recalls that time when you were diagnosed. That's something that is now a part of me. And going into a scan, I will be nervous. And for me, a lot of my fear is around my children. So my first, I guess, words that I said to my GP, they were with me when I was diagnosed. I looked at them in the consulting room and I said, well, what about my boys? And, it's something, of course, that as a parent and all of us, it's just, what about those around me? So I think for me, in some ways, I had the easier job, being the patient. I think I do remember a conversation with my husband in the kitchen. And I said to him, I couldn't do what you do. I don't know how I would cope caring for you. I would find that harder than being the patient. And I think a lot of us as patients do feel that, in one way or another, as hard as it is. So that is I guess, something which I acknowledge that it's a real concern. It's not something that I try and force away. I just process it and I acknowledge it as normal. And I have a new normal now. And, I appreciate that. As you've said, I've written a book. I get invited to speak at national forums and share my thoughts and feelings around bowel cancer nursing and how we can improve our healthcare system. I get to run a national survivorship program here in Australia, which is incredible. And as cliche as it sounds, I feel like I've stepped in to an important life purpose. And I get to speak to people like you, Jeff, and the Cancer Park team across the other side of the world. And if from this experience and this conversation, we can help just one patient have an easier journey, one carer or one clinician think about the way that they deliver care from a different perspective, then my job is done.
So after your surgery, you had a rough time. You have half your colon removed. That's where a lot of your water is absorbed and that sort of thing. You had, well, kind of describe your symptoms, and I'd like to kind of also ask you how you found some of the integrative complementary things that end up helping you, specifically acupuncture.
Sure. So I had, I'm a lean person anyway. So when I had the right side of my bowel removed, my bowel function was considerably impacted, which then led me to have consistent diarrhea. So I'm talking, 6-7 months of constant diarrhea. So that is quite a lot for a lean body to take. And as I've mentioned, a lot of us as patients think, well, that's just the way my life is now. I just need to be grateful that my cancers have been removed. And this is just a symptom that I just have to put up with. So although I would go to my GP and say, look, I do have a lot of diarrhea, it wasn't something that was being prioritized to fix. We just accepted that was, I guess, a side effect of the surgery type. I saw various dietitians who would, change my diet a little bit, but that didn't help. But it was only when I found the Bowel Cancer Australia nutritionist, who was an expert in the area, who put me on the right track with my diet. And after her advice, I would say within a month, I was a completely different person. I had a lot of muscle wasting. I had a lot of fluid loss. I was constantly dehydrated, malnourished. And I had, as I said, the dizziness as well. So it was tough, and because of that, I couldn't prioritize things like exercise, or I didn't think I could. Now I know in reflection, exercise is something that I absolutely should have done immediately and prioritize that. Complementary therapy or integrative therapy has been incredibly important in my journey. I was lucky enough in where I live up here on the Sunshine Coast, we have an integrative cancer centre called Bloom Hill Cancer Care, and they had in-house acupuncturists who specialise in cancer care. So every couple of weeks, I would go and have subsidised acupuncture sessions.
And that helped with digestion?
It did. It helped all of that, as well as my dizziness, as well as my mood, just feeling better. Yeah, absolutely.
So as a nurse, did you find that sometimes a disadvantage that you would potentially catastrophize things and, go down the rabbit hole of, God, my bowel must have perforated, or this, that, and the other thing?
Yes, I probably still do a little bit of that now. Lots of us clinicians probably do that. Again, the mind will recall worst case scenarios or what the textbook says that these symptoms could be. I did. So when I would have pain, for example, which a lot of us bowel cancer patients postoperatively will get some intermittent sort of stomach pain, over the many months. I would wonder, did I have a seed, or is there a blockage there that I need to go to hospital for? I did have a number of hospital representations for drug reactions and different things, which, again, complicated and lengthened my journey. But absolutely. But what I knew, Jeff, is that when I was in a good space emotionally, the catastrophizing reduced. So that was my sign that in order for me to become physically well, I had to be mentally well and working towards that first. Life became easier when I focused on my mental health as a priority.
Yeah. You have a chapter in there about body image and self-esteem. Obviously, there's some surgeries that leave more of a mark than others, mastectomies and, obviously colostomies. Obviously, you are dealing, although I guess you did most of your surgery laparoscopically, but some people are dealing with scars. There was times when you would look at yourself in the mirror and be real sickly. So how do you advise people deal with that?
Yeah, I think it's a tough one. It's something that we're not prepared for, and even though our surgeons and oncologists will do their best to support us, and from a surgical perspective, we will have an idea on what the postoperative recovery and what our body will appear like. But until you wake up in that bed and see yourself and look down and you have your stoma or you have had your mastectomy, you don't know what it's going to be like. And what I've seen through my experience in connecting with hundreds of patients is that really everyone has a little bit of a different perspective. So some patients will embrace their scars and think, well, this has saved my life. That is all I'm going to focus on. Without this surgery, I would not be alive. For other patients, their self-identity and image is such an important part of them. I always, advocate for a psychologist who specialises in cancer care. So link in early, at the time of diagnosis, as soon as you're ready to find someone to support you through your journey. And there are lots of different strategies that patients can do to help improve the way that they feel emotionally. So remembering, of course, that they are not just their body. So they still have a personality, they still have skills, they still have friends and family who care deeply about them. They're not just their physical appearance. Embracing other things that they enjoy, like hobbies, a little bit of lipstick or some bright colors, or listening to music, getting out and doing exercise in nature that we've spoken about. Look at those other things that you can do to improve your mood. Link in with a specialist. And here in Australia, we have a program, it's a national program, a Look Good, Feel Better program, which is actually a free program for women to learn about how the simple steps that they can take to help them to feel better. So find those experts, and I do talk a lot about patients being their own best advocates. So if it's bothering you, then it's important. If it's a question that you have, then it's important. So surrounding yourself with networks who can help you to answer those questions.
Yeah, you really emphasize being kind to yourself, and no comparisonitis was a good term. I think a toxicity that we tend to not recognize, or at least avoid recognizing, is there's the financial toxicity. And obviously for most of us that implies, the expense of the treatment and this, that, and the other thing. But, tell us a little bit about some of the other things that we don't necessarily consider. And that is, you're being out of work and maybe it affects how well your caretaker can work and that sort of thing. And what are the things that help you kind of manage that aspect?
Yeah, I think exactly as you say, financial toxicity, financial strain, financial burden is not something that our healthcare professionals will often talk to us about as a priority. The priority is always the life-saving care. And the most obvious one is loss of income from not being able to work. Of course, some patients can actually work through their treatment, and if that is right for you and your family, or if you need to, then that's something that you can pursue as a patient. There's not a wrong and a right. For me, I had income protection, which I was incredibly fortunate to have, but that was at 75% of my income. So already we had a 25% drop in the family income for me. My husband had just finished his PhD, so he'd been working part-time for 5 years prior. I had just had 2 almost back-to-back maternity leaves. And so for us, having my income, reduced over that time was significant. But then, of course, there's a cost of childcare. So in Australia, childcare, although it is subsidised, it is very expensive. And what I needed to do was to really have more time for me to rest and recover. So I would, put our children into our daycare as much as we possibly could when I needed it. But of course, I couldn't do that as much as I actually needed to because of the associated cost. There's costs. We needed help in the home, for example, for cleaning. There's psychology out-of-pocket costs. There was out-of-pocket costs for things like acupuncture, all of the complementary therapies. I had a lot of supplements and vitamins, which I took. I saw a functional medicine specialist, which was very expensive. It was significant. So for me, I calculated that it was in the vicinity of the 30,000 Australian dollars over that 1 year period, which is incredible. And for a young family, I was privileged that I could find that money in different ways. But I know a lot of people can't. And the financial stress on top of feeling unwell, on top of household stress, on top of worrying about the future, it is a real burden that we do need to support patients better with. I did, again, a lot of research in this space, trying to explore different supports for us, mainly in terms of the subsidised childcare, for example. But then I would see lots of patients, asking the same sorts of questions, who didn't have income protection, who might be single parents, who were younger adults or older adults and didn't have any sort of support. So in my book, I did cover a chapter there on financial strains and resources that patients can access. And I still talk to patients today who really aren't aware of the supports that they can tap into. So discounted services, for example. We do have some charity organisations that do have funding. There are things that we can do to make our bills reduced over that period. So I do encourage patients to link in with their national cancer organisation as well. And they should have connections with financial support services, at least in the terms of advice.
And social
so make it easier.
Social worker.
A social worker, yeah. So a social worker should always be accessed or available through a hospital. Some of our other community centres will have social workers as well.
So you had your nuclear family, your husband, I think your mom came and helped you. But when it came to childcare and meals and that sort of thing, it really did take a village. And what did you find out about your fellow mankind during this time? And I think you wanted to emphasize, if somebody's willing to help, then let them.
Yeah, absolutely. I say, cancer absolutely does take a village. And it can be quite confronting when you've been very independent prior to your diagnosis, and then suddenly you need help. And yes, I always talk about, delegating what you can. So writing out a list and, identifying those things that you can easily hand over to other people, whether that be meal preparation, walking the dog, transport to and from appointments, whatever it is you need that you feel comfortable with delegating, please do that. And people really do want to help. And what really surprised me was the amount of offers of help from people who I didn't really know, people who I would have classed as an acquaintance. or colleagues, for example, again, who I didn't really know. So that was an incredible experience because, you know, finding those people who I call the A-team, you know, bringing them around you to support you through your journey is key. You do not have to do this the hard way. The other thing I think, and a lot of people do find this, that sometimes the supports that you think will be there and the people that you think will be there just aren't there.
Right.
And by that, I mean emotionally available or physically available to support. So I talk to people about being open to who your A-team may be. It may also be a community organisation. It might be a church group. Just get the support in, and that's helpful support. And when people find that, for example, friendships have dropped off or relatives aren't checking in as much as you would like, you have some options there. You know, you can reach out and say, hey, I really need some help now. There's also the acknowledgement that for some people, your illness, it's just very confronting for them. So they may have had recently the loss of a loved one, or your illness may remind them of a very difficult history or a past situation. So it's not necessarily that they don't want to help, it's that they can't. And that's hard for us to take as patients. But it's knowing that we can access support in other ways. I think as well, what I also found helpful was to have my own psychologist and not expect my husband or my friends to be that person for me. So that was very helpful. And I also, my husband and I went to support together as well, separately. So I had my own support. We had support together as a couple. And I know from speaking to a lot of younger families and families who have older children, that getting early psychology support for children who are obviously old enough is very important as well.
So you mentioned that you didn't feel like you could really do exercise, and in retrospect, if you had to do over, you would have done something and maybe developed more capabilities to do more over time. Same probably became true with diet. You had a dietitian. Obviously, we are aware that there's more of an anti-cancer diet, and you know, a lot of that is whole foods and fibers and fruits and vegetables, and you know, less in the way of meat. And yet, you must have had the frustration that your bowel wasn't going to necessarily put up with all these changes.
Yes, and I think you know, prior to my diagnosis, I wasn't an unhealthy person in any way. You know, in fact, I was running, you know, 20 kilometers prior to that. You know, prior to having my children, I was very physically active. I had a good diet. And that, of course, is part of the frustration, because cancer doesn't always impact the people who you think that it will. In terms of recovery, when I you know, 7 different types of vegetables and all these different fruits, whole foods, seeds, nuts and grains. And of course, exactly as you say, I could not process those. So with that came anxiety and, you know, the fear around, well, I'm going to have a cancer reoccurrence if I can't eat the right food. And I, you know, in reflection, of course, that was me being unwell and not having rational thinking. So being able to link in to someone who's a nutritional specialist in bowel cancer, once I had that really good information that it's okay, Sally, you just need to let your bowel recover, right, and then you'll be able to do those things. So again, the importance of having the right experts around you can't be underestimated.
Now, as we come down to the end of our session, you had listed a couple of things that you wanted to make sure were take-home points from our session, both for patients and for clinicians. You want to go over those?
Sure. I think, you know, as we've talked about, for patients, not doing this alone, so surrounding yourself with help and the right type of help is really important. So we talk about the A team. Those are experts in your cancer type, and those are the most helpful inner circle people that you can bring in. Being your own best advocate is really important. So I think as patients, we often feel like we don't have power. We need to do what we're being told, and it's not okay to ask questions is sometimes how we feel, or to question perhaps a treatment plan. And what I would say to patients is that you are an expert in you, which means that you can ask questions, and that can be in the form of a second opinion, if that's what you would like. You need to understand your cancer and your treatment plan as much as you really want to. So do ask your questions. Do you advocate for yourself? If there's something that doesn't feel right, please say. Prioritizing you in your recovery. So swapping out I feel selfish to I am now self-caring is really important. There is nothing that is more important for you during your cancer treatment than you in your recovery. And the more that you can prioritize your mental health, your exercise, and your nutrition, the faster that you will be able to recover. And the faster you will be able to get back to caring for your family, interacting with your friends, getting back to work, looking after the grandkids, whatever that is, and whatever that is that's important to you. One step at a time. So often us as cancer patients, we want to know every step of the journey. We want to know when is the next treatment, when's the next scan, when are we going to, when is this all going to end as well? And the reality is that we don't always have those answers. We can predict that the cancer road can be rocky, and it's bringing in those strategies to ride the ups and downs of cancer, and just taking one challenge at a time and one day at a time. And on the hard days, that can be 1 hour at a time. So just, I guess for me, what was helpful was letting go of the needing to know everything right here and right now. For clinicians, our cancer, as we've talked about, particularly in its early stages, is very hard to diagnose. And very hard to diagnose in adults under 45. And without that national screening program, we're relying on patients to come in and talk to us about our symptoms, their symptoms. So when a patient is presenting with overt bowel cancer symptoms, colorectal cancer symptoms, please investigate the patient based on what they're presenting with and look past their age. Patient-centered care, person-centered care is really, really valuable. If we can look after the patient as a whole, including their family unit, see the person as a person, not as a diagnosis, and ask, what is it that is important to them? What do they need to be able to manage their condition? Then that will help us to look after them and improve their patient outcomes as well. And just very simply reflecting on practice and asking ourselves, what would we want right here, right now, if this was us or our wife or husband who presented with this cancer and this time in our journey. So really simple things. And of course, for any healthcare professionals who are setting up cancer care services, making sure that you have a strong connection with consumer networks. So making sure that their views and needs are considered, because our consumers really do have some really fantastic ideas, and they will tell us what basically does need to be prioritised in cancer care. So those, I guess, my key messages.
Yeah. Well, thank you so much for your time and your energy and what you're doing as a survivor, taking care of other people, and being anything but selfish with that. Again, Sally's book is A Woman's Guide to Navigating the Invisible Cancer Load. Sally, we talked about this, but I'm actually contemplating via the Cancer Survivors Park Alliance looking at a grant. I'll have some other nurses look at this book to see if it would be useful, but I would like it to have for all our new cancer patients to have access to this, because it really does provide a lot of answers to questions that we normally don't consider. So thank you for your time and for your efforts and for all you've accomplished. And again, we'll be over for your site visit as you get closer to your own Cancer Survivors Park. As per usual, we'll finish up with a quote. I did talk about our Northern Hemisphere, Southern Hemisphere seasonal differences. So this quote does, talk about different seasons, but it's also a metaphor for a cancer journey, and especially Sally's journey. So it's a quote from Albert Camus, and it's very, very, very short. But in the depth of winter, I finally learned that within me lay an invincible summer. So we will let you go here. Let me see, I have some other. Now everybody's just being very complimentary, and they can't wait to meet you.
Thank you so much. And thank you so much for your time and your interest in my story. Greatly appreciated. Thank you.
Get on with the rest of your day. We're going to all go to bed. Thanks, Sally.